So when a person comes in for treatment, is this going to be you're in a treatment unit, hospital, bed, community, or are you outpatient? What is it?
That's a good question, and the answer is we have to do an assessment and find out. And in the past, I think there was the idea that every alcoholic had to go to a residential treatment for 30 days, not 29 days, not 31 days. And that would be akin to putting every diabetic on the same dose of insulin. There has to be some individual assessment to determine the needs of that patient. And you try to match the severity of the disease of alcoholism to the intensity of treatment.
So what do you do if they go in residential, they go in-house, and it's going to be 2, 3, or 4 weeks? How do you help that patient?
The first priority is to maintain medical stability. We have to address any medical complications, liver disease, heart disease, brain disease that has developed as a result of the alcohol dependence. And we have to also manage withdrawal. We have to safely and humanely get that patient through the withdrawal process. And at that point, they're able to engage in the remainder of the treatment process, which would involve psychiatric stabilization. It would involve treating the family. Successful treatment has to involve the family. The family involvement is such a critical part of the treatment
What
process.
does the psychiatrist do?
The psychiatrist, just about every patient that walks through the door of a treatment center has some psychiatric symptoms. And our job is to determine whether those symptoms are the usual and expected part of early abstinence from alcohol or whether there's an underlying psychiatric disorder. And the psychiatrist can help us discern which is which.
So that evaluation can help you when the patient leaves the residential center, knowing how to best help that person.
Absolutely.
What other education, how do you educate the patient with the family?
Well, what we do at Cumberland Heights is conjoint therapy. We have the patients and the family in the same room and saying the things that they may not otherwise be able to say without the support of the treatment environment.
Is the family come in every day, or they live in the same community with the alcoholic in treatment? I would think the family's at home and the patient's in the hospital.
That's true, and we try to bring them together as best we can, and sometimes there's a week-long structured family care program where the family comes in all day for 5 days, and sometimes they may come in the evening once a week for education sessions, and we do an awful lot of phone sessions, and technology has greatly improved our ability to engage the family in the treatment process.
I've heard the following statements. Alcoholics are very cunning people, and if you're a family member, there's no real need to, it doesn't do any good to look for alcohol around or to do that. It's up to the patient to give them support. Where does that fit? Do you have to keep alcohol out of that house? Or
Well, I can tell you early on with abstinence, it sure is a good idea to have an alcohol-free environment for that patient to recover.
And I would think that would be essential. So the whole family has to grow together to get the patient well.
Absolutely.
How long is an ideal setting for most people, 90% of people, in-house? Is it 3 weeks, 4 weeks?
It again depends on the severity of the disease, and if somebody's got a stable home environment, they may be perfectly suited for outpatient treatment. If they've got a stable job and they've got a supportive family who's engaged in the process, outpatient may be perfectly acceptable. And if there is not a stable environment, if the patient doesn't have reasonable living skills, if they're in an environment that would be conducive to continuing the alcohol use, then we need to extend the course of residential treatment.